Good afternoon, everybody. Thank you very much indeed for joining us. We've just had the latest meeting of the Greater Manchester COVID Emergency Committee, and as ever, wanted to give you an update. Joined this afternoon by Sir Richard Leese, who will update on health, particularly the contact tracing system in Greater Manchester, and by Councillor Andrew Weston, leader of Trafford Borough Council, who will be providing an update on clean air as Greater Manchester's lead on the Green City region agenda. So we've just had our meeting, and leaders and myself have been presented with what I would say the most improved picture we've seen so far since the start of the pandemic. Over the last few days, the latest figure was 477 new cases, which is the lowest we've seen, as I say, since the early weeks of this crisis. The numbers admitted to hospital stabilised now at around just under 20 per day, and the number of people in hospital is coming down to overall around 750 people in hospital. The situation in our care homes, though, of course, continues to require vigilance. Latest figures suggest 31% of our care homes, just under a third, reporting a case of a resident within the home. So that's down a little bit from around 34% last week, but nevertheless still a cause for concern. Just to take you through a few issues before I hand over to Sir Richard. Obviously, with the easing of lockdown, the transport system across Greater Manchester is beginning to experience a gradual increase in pressure. There is certainly a noticeable increase in the number of cars on the roads, and both our bus operators and Metrolink report a slow but steady increase in the number of passengers. As a result of that, leaders have today decided to increase frequency of Metrolink services with effect from next Tuesday, to the Tuesday after the bank holiday. It will go from a current 20-minute service that it's operating on to a 12-minute service, which we can just about manage within the funding situation that we've got. I have to say there has still not been a further funding deal from the government. We are in discussions about that. But we would not be able to increase the frequency any further without a significant funding package. A couple of other things just to update you on, more a point of a reminder, really, I guess. You'll recall that we introduced free travel on Metrolink for NHS and social care staff. When we introduced that, the offer was due to expire at the end of service on the 1st of June, and it's just to confirm that that will be the case, and that it will change from the 2nd of June. And that is also the case with regard to the 9:30 threshold for the older people's concessionary pass. We moved early to suspend that, recognising that the pressure on supermarkets and the difficulty some older people were facing in getting to supermarkets to find things within them. Like other places, we relaxed that, but the funding the government has given to the bus operators will not include that anymore. So we've decided that too will change on the 2nd of June, and the 9:30 threshold will have to be reinstated. Of course, that is to ensure that we do ensure there is capacity during the morning peak, particularly at this time when we need to provide for social distancing, and it is the right move to make as more people come back to work and to the transport system. Just a quick word about homelessness. We will say more tomorrow about a bed every night phase 3. This is our scheme, as you know, Greater Manchester's own discretionary scheme that seeks to provide somewhere for all people sleeping rough in the city region to go every night. We had anyway been working on a phase 3, but that now is being modified with regard to the effects of COVID. But a decision was taken yesterday by the Joint Commissioning Board of the NHS and our local authorities to commit new funding to A Bed Every Night phase 3 to begin from July, and creates a real opportunity for us to manage people who've been in hotels and apartments as part of the Everyone In scheme. It enables us to create a route where we can begin to make a transition beyond that scheme. We think that's a positive development, and we want very much to work with the government to see if they can also step forward and help to ensure that there is a positive legacy from Everyone In. And we will say more about that tomorrow and issue a full press statement on our intentions for A Bed Every Night phase 3. I'll just finish by saying something about the significance of this week that we are in. Of course, we are approaching the 3rd anniversary of the appalling attack on Manchester Arena, and I have been in contact, communicated with the families today to tell them all that we are thinking of them at this time, and it's particularly difficult for them given the situation that we are in. Difficult at any time, but certainly even more so now. And of course, that means we can't mark the anniversary in the way that we would have wanted to do because of the restrictions that are in place. But nevertheless, we've tried to put in place appropriate arrangements for the anniversary to be marked, working with colleagues at the City Council. There is a cathedral live stream that will happen in the morning and in the evening, working with local radio stations too around the pealing of bells, but also an announcement today that the United We Stream platform will put on a tribute on Friday evening. The former Spice Girl or current Spice Girl Mel C will be hosting and DJing. We will have the Manchester Survivors Choir performing outside Media City and being joined by Catherine Tilsley, who will also be performing. We'll say more in due course, but wanted people to have prior notice of what is coming, because obviously a difficult day for everybody in Greater Manchester, but one which we want to mark in the most appropriate way that we can. So thank you for listening to that. I will now hand over to Sir Richard.
Thanks, Andy. And different background for this week. So if Andy Bounds is on the call, he's just going to have to guess whether my irons moved or not in the past week. And I will not be answering questions on it either. I understand that there are people on the call who do like numbers, so I'll run through the numbers in a little bit more detail to the headlines that Andy's given you. I'll say that cases are down, and that's the 4th week on the trot where the number has come down. That's gone down from 730, an increase in cases of 737 4 weeks ago to 438 over the last week. I have to caveat that all those numbers are pillar 1 cases, i.e. people who've been tested in hospital and have been found positive. At some point, and we still haven't got it, we will start to get stats from the national testing regimes that are taking place, for example, at the Etihad and the airport, and that does mean that those numbers will then appear to be inflated at that point. Actually, what it will be doing is just giving us a more accurate position. Similarly, with the deaths in hospital figure is now less than a third of what it was 4 weeks ago, and seems to be on a very positive trajectory. Of COVID patients in intensive care, another reduction of 14 cases to 77. And I'm going to be told off for giving these numbers too quickly in a minute, but that in COVID cases not in ICU beds, a reduction of 28 there. At the same time, bed occupancy overall has gone up. It's only gone up a couple of %, but that does mean we are slowly beginning to get non-COVID patients coming back into hospitals. And I think we've seen some positive signs. We've seen an increase in the number of stroke patients that are now presenting, and that's really, really important. We've talked about stroke patients before, minor heart attacks, certainly talked about cancer and paediatrics, that we are beginning to get a positive trend, but we really need a lot more of getting people who should be presenting either to their GP or to hospital to be doing that, and we really need to get that message out. Andrew's talked about care homes. Talked about the number of care homes with COVID symptoms. I think I should say, in the way that we monitor care homes, that we don't count them as being clear until they've had 14 days without any symptoms. So it may well be that a lot of those care homes don't currently have any symptoms, but we don't take them off the list until we've got 14 days clear. In terms of the number of people in those care homes that have got symptoms or have been diagnosed with COVID, that's gone down from 6% of the total population to 5% of the population within the care home. So that's also going in the right direction. We've put a lot in place to support care homes. Everyone now has a designated link clinician. That's not instead of people whose home it is its own GP. That's on top of that. We do have systems for testing within care homes. And we also now have a recording system that covers every care home in Greater Manchester, that allows us to give a score from 1 to 4. A score of 1 means that they're perfectly able to look after everybody there. 4 means that they've got real problems. At the moment, the whole of Greater Manchester is scoring on a 2, which means it's not perfect, but we are in a pretty good place from that point of view. I will say a word about PPE. We're certainly past crisis point in terms of PPE. There is still a little bit of a hand-to-mouth existence in some areas. I think these are interesting numbers. If we look at PPE for care homes, 5 million items of PPE supplied from the national supply, 19 million from Greater Manchester, and that doesn't include what each individual local authority has supplied to its care homes as well. I think a real demonstration that what we've been doing at a local and Greater Manchester level has really made an enormous difference for our care homes. I think the last thing I want to say is that we do have up to date, or not up to date, but the most recent ONS stats about the all causes death rate in Greater Manchester, and this is based on the registration of deaths, so it more accurately portrays the totality of deaths and also where people have died, because clearly that's reflected in the registrations. There was a peak in all causes deaths caused by COVID-19. That peak appears to have been reached round about somewhere between the 13th and 20th of April, and we've been on a downward trajectory on all causes death since that date. Again, all of these are signs that we're going in the right direction. Just a couple of things I want to add on May the 22nd. First of all, it is to note that this week we started the public consultation on the permanent memorial, the Glade of Light, to go in beautiful garden space in front of Manchester Cathedral. I say the public consultation because families of the bereaved were consulted in advance of that public consultation starting. That we've always had a very clear policy of families first and making sure that they do know before anybody else. We are welcoming now though public comments on that. One of the events on Friday night at 10:31, we can't have people gathering at St Anne's Church for the chiming of the bells, but we can have people gathering around a radio, and thanks to certainly to Radio Manchester, and I think 1 or 2 other radio stations now who've agreed that they are going to broadcast the chimes at 10:31 to allow people in their own homes to virtually come together for that moment of reflection, that moment of remembering. I'll finish with that.
Thanks very much indeed, Richard. And
I've just forgotten. I've forgotten something completely, Andy. Sorry. Yeah, sorry. It's which is of course to do with contact tracing, and I think it's just to say that This morning we did agree quite a detailed paper on what's now become triple TI, that's testing, tracking, tracing and isolating. We're proposing to start the local arrangements on that next Tuesday, tying into national arrangements, using expertise we already have in public health, trading standards and so on. We have a lot of people that already have expertise in these areas, not enough in the long term, and we'll have to be training more people to do that. What they're going to be concentrating on initially are cases referred from a national level. And these are going to be the complex cases, which can't be dealt with through a simple phone bank, but also dealing with the consequences as well. That if we find as a result of this that there are outbreaks, it will also allow us to start managing those outbreaks and making sure that they don't spread more widely. Sorry, I will finish on that now.
Thanks a lot, Richard. So I'm now going to hand over to Andrew Weston. Obviously, we've all been enjoying the benefits of clean air, and we want to keep that. But nevertheless, we have to do something because the legal instruction from the government to act on clean air doesn't go away. And obviously, leaders now have to decide how to move things forward. And Andrew's been taking the lead on that for us. And I'll hand over to him. Andrew.
Thanks, Andy. Good afternoon, everybody. Obviously, as we've just heard from Richard, we're still very much engaged in responding to the coronavirus crisis. But one of the principal things that we are starting to do, as you would expect, is turn towards what recovery will look like. And for myself as Green City Regional Lead, and I know Andy and other leaders are supportive of this, is making sure that as we build back better, that means that we build back cleaner and greener than before. One of the principal benefits, one of the coronavirus, has been the way in which our air quality has improved across the city region and indeed nationally. So the government's air quality advisors into the DEFRA committee have estimated that nitrogen dioxide levels have fallen by up to 30% at the roadside. And clearly, as we move forward, that's something that we want to ensure can become a permanent fixture to clean up our air, not least actually because we are starting to see evidence now that there is a link between the expectation that somebody will die as a result of contracting coronavirus and poor air quality. So it's an extremely topical issue, not only because of the benefits that we're seeing, but because of those links that are starting to appear. That said, here in Greater Manchester, we have for some time now been working towards the development of a clean air zone for the city region, and that is work that we're very, very keen, in light of the improvements to air quality that we've seen, to press on with as quickly as possible. That said, it is important to recognise that coronavirus has had an impact on our ability to move forward with our plans, and I will be bringing a paper to the Combined Authority meeting on the 29th of this month, which will be published later today, that sets out an update both in terms of our asks of government, but also what the crisis has meant for the timetable as we currently see that. So just in terms of our asks of government changing, we are looking forward to bringing a clean commercial vehicle fund ask of £98 million to ask of ministers. That had previously been £59 million, but has been increased in light of the latest evidence. We're also looking to provide support to sole traders and small businesses by seeking funding for a £10 million hardship fund to support those most impacted by the shift to cleaner vehicles. But also it's worth noting that we do have some funding in the bag, as it were, from government now. So our total ask is £166 million. The amount that we've managed to secure so far, not including the implementation costs, is £41 million. So our message today, really, and moving forward, is that we really need to see a significant uplift in that to provide us and local businesses with certainty that the impact of moving to the cleaner air that we all want to see will be manageable for businesses, and that the support that they need will be in place. But as I said earlier, there's necessarily been an impact of coronavirus on the ability we have to carry out what would be a meaningful consultation on our clean air proposals for a CASC clean air zone. We had intended to consult in the summer, but due to concerns around our ability to do that under social distancing guidance, and also with so many businesses closed or working from home, the extent to which we feel that they will be able to meaningfully engage with that consultation is also impacted. And therefore, we're having to say that whilst it's still our clear intention to consult in 2020, we do need to adopt a position of consulting as soon as is reasonably practical. And I'm sure you'll all understand that there will be a further decision down the line on exactly when that will be, as government guidance changes and it becomes realistically possible for us to carry out that meaningful engagement. What that does mean, and government are aware of this and understand the position that we find ourselves in, is that the date for implementation of the clean air zone will move from 2021 to 2022, but that should not materially impact our ability to achieve compliance as per the requirements of us by government by 2024. So that's the situation with regard to the clean air zone and consultation, but that in itself has a necessary impact on our proposals around minimum licensing standards as well. And obviously we want to make the transition to cleaner fleet as easy as possible for taxi and private hire vehicles, and to provide any support that we can. One practical way that we are looking to do that is to run the consultation on minimum licensing standards alongside the clean air zone consultation, because we think that asking vehicles to look at potentially two different upgrade requirements of them makes no sense at all, and also that there would be scope to align the minimum licensing standards as part of the financial package that will be available to taxi drivers as a result of the funding that we hope will be forthcoming for the taxi fleet. So for that reason, the minimum licensing standards consultation will remain aligned, and obviously we'll push back as part of the work around the clean air consultation, and again we'll proceed as soon as reasonably practicable. So in terms of where we're at, it is a slight change, but just to reiterate, we are serious about wanting to build back cleaner and greener. This is really important work for us. We've all seen the benefit of cleaner air over the past few weeks, and as soon as we can get on with that consultation, we're committed to doing so. Thanks, Andy.
Thanks very much indeed, Andrew, and thanks for your leadership on this crucial matter. I think we're beginning to see how Greater Manchester may build back better once these plans are developed, because by aligning the change in the taxi industry with the clean air change, I think people will begin to see how you can improve the transport system in a coherent way. I should say that we will be coming back later this year to the whole question of bus reform, and obviously that is connected to the clean air agenda as well. And yesterday, leaders endorsed moving forward on the procurement of a bike hire scheme for Greater Manchester, and to move as quickly as we can on that. It wouldn't be in place this year, but hopefully at some point next year, possibly around the middle of next year. So work is moving ahead at pace on that, and obviously it's all complementary to the clean air zone that Andrew has just been developing. So Ross, I think we're probably ready to take people's questions.
That's great. I'm going to take questions from Nigel Barlow first. Andy, to you first. Are you concerned that there appears to be the start of a blame game between national political leaders and scientists, and is follow the science, and is the I think basically I don't understand the last bit there, but you know, is there a blame game beginning between political leaders and scientists? And then I'll pick up a point for Richard.
Well, thanks, Nigel. I think you may be referring, Nigel, to the report of the Science and Technology Committee yesterday, which was looking at some of the key decisions taken, particularly the decision to suspend the community testing programme in early March, and certainly there would appear to be a difference of view in terms of some people questioning Public Health England, and they were also saying that it was more a minister or Department of Health or ministers. I mean, the thing I would say, Nigel, it's really important that we don't get drawn into the inquest at this particular moment in time. Even though the figures are moving in an encouraging direction, there is still a large number of people being infected with the virus in Greater Manchester from one week to the next. And there are still a lot of people in hospital. And I think it's very important that focus remains on that and on how we kind of manage the incredibly complex job of bringing the city region out of lockdown. And for me, the inquest comes later down the line. And I would just say at this stage, it's important that we kind of challenge the government on things where we think change is needed around transport funding, around homelessness, on current issues that affect our ability to manage this. But I think the backward looking part of this needs to come later.
Thanks very much, Andy. I'm going to take a question from Nigel as well to Richard. Nigel from About Manchester asks, do we have any indication yet how the majority of people in GM caught COVID? Was it the case that it was in care homes or hospitals and doctor surgeries? And he's also asking, is the R rate number artificially being overstated, thus not reflecting the general public, and should this be taken into account in any models for relaxing lockdown? That's at 148.
Thanks, Nigel. I think the real answer is that we don't know enough yet, and until relatively recently, the only consistent testing that was taking place was in hospitals and in care homes, and that is always going to distort the information we've got. I think I reported to you 2 weeks ago that as testing became broader, that we were beginning to see indeed a majority of cases in community settings, not in hospital settings. That continues to be the case, which would suggest that certainly a lot of the contacts that are causing the virus to spread are not in those hospitals or care home settings. We still don't have the data from the national testing arrangements, so the things that at the Etihad and the airport, for example, we don't have the data from there. So there are an enormous number of people who are being tested, but we don't know who they are, we don't know where they work, we don't know what their results are. Until we can get all of that data over a period of time, we really can't answer that question. However, what we do know is that lockdown, to a large extent, has worked, in that the number of cases has reduced quite drastically as a result of lockdown. And the fact that lockdown has worked would seem to suggest that actually people were contracting the virus in a whole range of settings. So if it's only hospitals and care homes, lockdown wouldn't have worked.
Thanks very much. Question for Andy. There's two questions that are quite similar, and I think we'll bring Richard on afterwards. But on Tuesday, the Health Secretary told Parliament the 21,000 contact tracers had been recruited in England. How does this affect GM? And then Richard, the same question, because I know you've picked up on that in your points, but also, has there been any significant change in the R rating that was reported last week? So either Andy or Richard might want to come to that one.
So on the national contact tracing system, it's obviously beneficial for Greater Manchester that the government has made progress on the recruitment of those 21,000 contact tracers. So we will benefit from that, as all areas will. What we've been discussing today is how we add value to that system, and particularly how we take responsibility for more complex contact tracing, certainly within social care, within our homelessness settings, and other places too around the city region where there is a more detailed job of work to be done. So I think finally this system is taking shape both at the national and the regional stroke local level, and the paper that Sir Richard referred to, which has gone through our committee today, I think allows our system now to begin to really come on stream from next week. So there is progress now. And yet there still is a need to just ensure that there is the proper interface between the national work and the correct referral of extra cases to the GM level, so that we can then do the extra complex contact tracing. So still a little to be worked out there, but certainly positive developments over the last week.
Thanks very much. Richard, I don't know if you had anything to add to that one.
Well, I think probably add a little bit from a local perspective. And I think the national service is really important. We've always supported that, but clearly the level of training, the level of skill that the contact tracers have at a national level and the way they're working allows them to deal with the bulk, but not the difficult cases. And there is real expertise at a local level that can deal with the sort of cases that Andy was talking about. But even then, there are not enough of them at a local level. So we will start off with the resource we've already got, but we are going to have to train more people in Greater Manchester in order to be able to provide that service. So there are going to be both staffing issues for us going forward, but also finance issues as well, because we have to ensure that we can pay for the number of people that we're going to need. And we're estimating that we're likely to need people doing contact tracing at a local level in greater numbers than we've currently got for maybe 18 months to 2 years. So that there is a big challenge for us there. In terms of the R number, we've got no update on what we had as a Northwest figure last week. So really there's nothing else that we can report on that.
Thanks very much. It's a question from Adam Clark at Roch Valley Radio, and I think it's one that all three might want to come in on, but we'll go to Andy first. Do you agree with Bury Council's decision to not reopen schools on June the 1st?
I strongly agree with the right of councils to make their own judgment on this matter, and obviously the judgment of a council in one place might be different from one in another, because the circumstances vary across communities and across the country. So what I support is flexibility for councils to come to their own conclusion. I think an arbitrary date at a national level is something that has presented a lot of councils around the country with some difficulty. And what I would say is we need to give them that flexibility. If they need to delay by a week or a couple of weeks, to ensure that safety issues are properly taken care of, then that is something that, to me, shouldn't be controversial or problematic. Councils should be put in a position where they are able to make those judgments, looking at the latest data. And as we know, the data continues to change. So I think it's right that Bury have taken their own decision. And from my point of view, I would support any of our 10 in any decision they made. If it was to open on the 1st of June, I would support that, given that they'd made a judgment that was right. But equally, if some think more time is needed, I would support them in that too. It's about supporting flexibility and a crucial role in decision making for councils who are closer to their own communities than anybody else.
Thanks. I don't know if Richard or Andrew want to come in on this one.
Well, I'll come in briefly. I agree with what Andy's had to say. I think if you look at all 10 districts in Greater Manchester are doing different things, and that's because their circumstances are different. But first of all, it's worth saying that they're not reopening schools because they've never been closed. All of our schools have been open all the way through the crisis in order to be able to provide for the children of key workers and for vulnerable children. So, and that's true across all 10 districts. So we're not reopening schools because we haven't closed them in the first place. If I take Manchester as an example, then we will not be complying with what was set out by the Secretary of State for Education, because we are approaching the expansion of children going back into school in Manchester in a way in cooperation with our head teachers. So we've been discussing this with head teachers. We've agreed with them the basis on which we're going to operate, and that seems to me a more sensible way to approach this than taking an instruction from somebody in Westminster.
Thanks. I'll move on to a question for Andrew. It's from Adam Clark at Roch Valley Radio. Are we starting to see a positive impact on the environment now that there has been a considerable drop in traffic on our roads? And what kind of long-term impact will this have?
We certainly are. So we have seen an estimated sort of 52% drop in journeys across Greater Manchester at the week commencing the 4th of May. And as I said earlier, that has had a material impact on nitrogen dioxide emissions, which are down between 25 and 30%. Looking at measurements on Oxford Road and in other parts of the city region, which is in line with the government stats, which say it's around 30% everywhere. So that has had a really positive impact on the environment, obviously, and that's something that we would want to see sustained moving forward where possible. So through a range of initiatives, really. So in particular, the Mayor's Challenge Fund and the walking and cycling strategy for the city region. I know councils across the conurbation have brought forward a number of schemes to enable walking and cycling and to make those safer where they can. In Trafford, we've brought in some temporary cycle lanes, but some of our more significant pieces of work I expect to see brought forward over the next couple of days, really, and to go through our internal approvals process. And it's really just encouraging that modal shift where we can. I think people will, particularly given the government advice around public transport, be looking for other ways to travel around, and obviously we really want to be where we can supporting people to do that in a sustainable way, because the environmental benefits that we've seen so far have been significant.
Thanks, Andrew. There's another question which will go to you first as well. It's from Martin George at the Local Government Chronicle at 159. How will the pandemic affect the Combined Authority's 5-year environment plan, and what will you do to make the post-COVID recovery climate positive, avoiding things like increased emissions from private transport? So go to you first, Andrew, and we might bring Andy in after that.
So I think the latter part of the question I hope I've answered by outlining just the way in which we're trying to enable people to make sustainable journeys where possible, and that indeed that work will continue in the weeks ahead. But that's in addition to what has been quite a long-standing scheme throughout Andy's time as mayor. And in Trafford, over the next 3 years, we had £35 million earmarked of investment into walking and cycling measures across our borough. So that's an important point to make. In terms of the 5-year environment plan, we have continued to meet as a Green City Region partnership and to make sure that we're delivering against the plan wherever possible. We have seen a slight impact in one area, which is our local energy action planning work, but actually we're hopeful that that's just a slippage from a May start date to a July start date. But a number of other areas of work, for instance, our solar PV purchasing pilot that is pressing ahead as planned and looking at installations that will add an additional 1.7 million megawatts to the network. So that's really, really positive. We supported the launch of the All Our Trees document a week or two ago, which is the tree and woodland strategy for the city region. So we're really keen to keep this work very much on the front line of what we're doing in terms of response and recovery, but also taking advantage where we can of new opportunities that have come forward as a result of the virus, which is this immediate impact on air quality, and making sure through the work that I've outlined that we do look to press that advantage moving forward. So trying to keep the show on the road where possible, fairly positive that we've been able to do that so far. One area of work that has slipped somewhat, but everything else very much is all systems go.
Thanks very much. I don't know if Andy, you want to come in on that one? Yep.
Yeah, just to add to what Andrew's said, of course, we're looking at a prolonged period of constrained capacity on public transport because of reduced number of services and social distancing on the services that we do have. So I think it's possible that we'll see a short-term rise in car use and therefore the emissions from it. I think we just have to probably be realistic about that. But I am optimistic, as Andrew was saying, that we can build back cleaner and greener from this. And I think what you're hearing today is our plans are really beginning to take shape on that, moving forward with the Clean Air Zone proposal, but at the same time recognising the need to support our small businesses and our taxi drivers, starting the procurement on a bike hire scheme, Already we have in hand plans for electric vehicle charging to start points, new ones to start appearing around the city region. We want to press ahead with bus reform, and that too will be linked to cleaning up the vehicles on our streets. So a lot of complementary developments taking place here, and we do believe, even if there is a short-term impact, we can start to soon have a very coherent plan for a climate positive recovery from COVID. But just to add as well, of course, we'll be going to the government soon with further asks beyond clean air, particularly asks to support the economy, to further new industries, create jobs. I'll mention it again. We think the retrofitting of domestic properties is an obvious candidate for prioritisation coming out of this situation. There are potentially thousands of jobs that could be created with a retrofitting programme around Greater Manchester, and that, of course, would support people into work who might otherwise be facing redundancy. One of the ideas that I want to develop with the government is whether the furlough scheme for younger people could be turned into what we used to call the Future Jobs Fund, where people might have opportunities where part of their wages are paid, and that could be the beginnings of a retrofitting workforce. And certainly would want to develop that conversation with ministers. It's a moment, I think, to deal with the housing crisis. So not just retrofitting properties, but building new homes for social rent, particularly zero carbon homes for social rent. I think we can make the recovery from COVID climate positive, but it will require a very strong partnership between national and local government, and that's something that we're arguing for.
Thanks very much, Andy. I'm going to take a question from Jen Williams at the MEN and go to Richard on this one first. It's a question for all three. What is your own personal position on whether private vehicles should be banned from the city centre as part of air quality plans? Manchester Council has previously said it is now in favour, but as far as Jen knows, this isn't in the GM plan currently. So go to Richard on that first, and then to Andy.
Well, we are in the middle of completing the city centre transport strategy, again held up by COVID, but the position of the City Council remains not to ban all vehicles, by the way, but to ban through vehicles, because people will need access for a variety of reasons. But we would still want to ban through vehicles of all sorts from the city centre. Beyond that, we want the city centre to become increasingly a pedestrian-dominated space. And clearly, if it's going to be a pedestrian-dominated space, that means less vehicles, including private vehicles. We'd like private vehicles to be, if they are going to be coming into the city centre at all, to be parking towards the edges of the city centre rather than in the middle, so we can create that improved pedestrian environment. And as increasingly, we would want to move to servicing at particular times rather than something that can happen at any time of day or night. So that is a direction of travel. I don't think it's something that we can do overnight, but it's certainly what we would like to do over a period of time.
Thanks, Richard. I'll bring Andy in on that one.
And maybe Andrew might want to comment as well, Ross. But I mean, I just to basically support what Sir Richard has said. I think the pedestrianisation of the city centre is a really positive development, and it will, I think, improve air quality, but also general quality of life. The space will be, I think, better for people, safer. It will be better. Obviously, it will be cleaner as well. And in some ways, it goes ahead of the clean air zone, the process of pedestrianisation, and almost answers that question before we get to a point of whether the changes the City Council wants to see should be done via a clean air zone mechanism. It's better, I think, for it to be happening in the way that it is, and certainly I think Sir Richard and his colleagues at the City Council have shown real leadership on this, and I think Manchester City Centre will be an even better space to be going forward.
Thanks, Andy. Andrew, you want to come in on this one?
So I obviously strongly agree with that. I'm very much in favour if this is something that the City Council decides to go ahead with. In terms of why it's not in the clean air zone proposals, it's because it's almost a separate matter in that it is a clean air zone proposal that allows us to achieve compliance by 2024, but we do not want that to be the extent of our ambitions. We've never said that that is all that we should be doing to take forward, and any work that the boroughs are doing locally that supplements that work is very much welcomed by me as the Green City Region lead. I think the key point is that we are required, and importantly only receive funding for achieving compliance by 2024 through the clean air zone proposals, but any work beyond that can only be positive as far as I'm concerned.
Thanks very much, Andrew. It's a question for Andy, but let's come to Richard on it. It's from Victoria Glover at Hits Radio. We've received several reports of technical glitches caused by people not getting their test results back. Barcodes aren't linking up to people's details, and the results aren't coming through until the patient rings to escalate the case after 7 days. Is this something you're aware of, and is it good enough?
It is something I'm aware of, because I've received similar emails myself, Victoria, to the ones that you've received. And is it good enough? No. But I have to say I'm not fully aware of all of the details as to why this is happening. I think it is national testing sites where this is happening, and I've heard some reports that the tests are being sent overseas for processing, and that is causing the 7-day issue that you mentioned. And potential greater opportunity for confusion. But no, I am aware of what you are saying. Maybe I'll hand over to Sir Richard, who might know more about the details as to why this is happening, but I think it is linked to the national testing contracts that have been put in place.
There is very little I can add to that, because, as I've said earlier, is we have a real problem of getting any data out of the national system, and there clearly are problems with data gathering around the national system, and that, I think, is reflected in the question that's being asked. It's also why we've argued fairly consistently that there needs to be a greater local involvement in collecting and using the data around testing as well. So it would certainly be very worrying that this is going on, because when I started talking about testing, tracing, tracking and isolation, but what we're absolutely clear about, for that to work as effectively as possible, means that we need to have good quality data about who is being tested and what the results are, both at a national and a local level. And if we haven't got that, it is going to undermine our efforts going forward over the next 12 months or so.
Thank you. Richard, staying with you, Kevin Fitzpatrick at Radio Manchester at 2:20 said about care homes. He said that all residents who fall ill are apparently being given a 28-day statement of intent notice and told that they won't be taken to hospital even if their symptoms even if the symptoms they show aren't related to COVID. It's a case of a woman with a urine infection who was given a notice. Worries that older people are being left to die when there's plenty of space within hospitals.
Well, I'd say, Kevin, if that is true, then it's absolutely outrageous, and certainly not something I could support in any way. There is certainly no policy in Greater Manchester for that to be the case. I would hope, if it is true at all, that it's an isolated incident, but I can say that if there was a general practice of that sort, then I would want with the officers of Greater Manchester Health and Care to be tackling that in a very strong way. I'm sure Andy would want to do that as well, because that's if it is true, it's simply unacceptable. Having said that, there are a number of these examples have been suggested. So far, nobody's given me details of a real case. So, Kevin, a question for you. If you've got details of a real case, let me have them and I'll follow them up.
Thanks, Richard. Bring in Andy on that one as well.
Just to say, Ross, I strongly agree with what Richard has said. If it is happening, it's outrageous. But to make the appeal for anybody either in the media or in the public, if they have any evidence of this kind of practice, to bring it to us, and I can give you an assurance that both Sir Richard and myself, we will look into it. I mean, just to say something more broadly, Ross, if I may, to reflect a discussion that happened at the COVID Emergency Committee today, and that went along the lines of there needing to be more focus on domiciliary care alongside care homes. I think the way this thing has developed so far is, a lot of focus on hospitals, then a focus on care homes. We are conscious that there needs to be a focus on domiciliary care as well, and where people are discharged from hospital back home, that there need to be arrangements in place to ensure that there isn't spread of the virus in the community. And it's just an issue I just mentioned in this, given the raising of care homes. I just think domiciliary care is something that myself and the 10 leaders have asked for a greater focus on, to ensure that we are not also seeing spread of the virus in the community linked to domiciliary care.
Thanks very much, Andy. We've got the final question at the moment. Some may come in, but if they don't, following this question, if anybody has some final statements as well. But the question to Andy, you first, is on schools. Specifically, what local circumstances are you referring to that might lead to different councils and GM to take different decisions? The infection rate is no higher in Bury than in other parts of GM. So I'm going to go to Andy first on that, and then we'll go to Andrew.
Thanks, Hannah. I'm not sure you can make that statement about the infection rate in Bury not being higher than other parts of GM. We simply don't have the data, Hannah, at the moment to make a judgment of that kind. The figures are obviously held at a higher level, and there may be particular issues, may be anecdotal, but there will be concerns in particular communities around outbreaks or clusters. So those are local circumstances that head teachers, I'm sure, would be cognizant of. But also there are issues around staffing, the logistics of getting the school fully back up to, or not fully back up, but a significant extra number of students coming into school. So it's why I would want to echo what Sir Richard said a moment ago. Let's leave this to the judgment of head teachers in consultation with local authorities. An arbitrary date at a national level, in my view, doesn't seem to be the right way to go. Yes, let's all agree to getting people back in school, kids back in school as quickly and as safely as possible, but allow local flexibility as to how that precisely is achieved. That just seems to me to be clearly the right way to go about this.
Thanks, Andy. We'll bring in Andrew on that one.
I think that's the key point, really. From the outset, GM and the Northwest have been tracking a couple of weeks behind the rest of the country in terms of where we've been at in fighting the virus. So an arbitrary date across the country was obviously problematic. But as Richard and Andy have both said, it should be a matter for schools as well as local authorities to determine that. And I'm a governor at a school where we have real issues with reopening to children more widely because of space issues and the number of key worker and vulnerable children already on site. So we're an infant school. That means that we have capacity for 70 kids. But we're currently already taking 56. So from a management perspective of that proposed increase and how we engage with parents as to how that will work in practical terms, that it is a logistical nightmare for some schools. But the other point as well that I think is really important is that in Trafford, we do feel that the announcement has been premature. We have said we will support any head who feels that it's not safe for them to open, and we have said to our to our primary schools that it should be the 10th of June at the earliest. But we will support schools, and it's right that we support schools that feel that they can open to make sure that it's the safest place possible. But when we are saying that it is different to the government guidance for all of us, and we've all put forward slightly different positions, the issue there is that we are 10 days to 2 weeks behind the rest of the country. So an arbitrary figure was never going to be an acceptable one-size-fits-all approach.
Thanks, Richard. If you want to come in on this one.
No, I agree with both Andrews. The only thing I would add is that even within Manchester, just as Andrews described for Trafford, not every school will be doing the same thing, because they all have. We are trusting our head teachers to make judgments about what's right for their school.
Thanks very much. I think final question from Jen Williams. It's a question, Sir Richard, we'll stick with you on this one. How serious are the consequences of not getting testing data back from the national system? You've touched on this already, but surely if you don't know what the stats are for a whole section of people tested, it must have quite a significant impact on your ability to know current trends here. What proportion of test data are you missing as a result? So Richard, if you want to take that one, and then we'll go to Andy on it.
Okay, as this I think will be my last bite, I'm going to add something in advance of that, which is really to remind everybody that it's Mental Health Awareness Week this week. We have seen a rise in incidence of mental health, particularly amongst young people, as a result of COVID-19. So it's brought it into very sharp focus. And we do want to get a very strong message over through Mental Health Awareness Week that if you're in crisis, if you need help, then seek help. That through Greater Manchester Health and Social Care, through mental health trusts, through local helplines, there are lots of routes there for people to get support. Let's get that message out to people. Don't be ashamed of mental health problems. Let's get rid of the taboo. If people need help, seek help. In terms of the question itself, Jen, I'm going to ask you to try and look at the pandemic in a slightly different way. I'm going to ask you to, as a very large collection of localized outbreaks, because that in many respects is what it is. And as we start to dampen down COVID-19, it becomes the gaps between those outbreaks, both time and geography, become greater. One of the things we need to do in order to be able to return to normal is something that we might, for example, do regular with things like meningitis outbreaks, that is to be able to localize it and contain it, because there undoubtedly will be outbreaks of COVID-19, but if we can identify them, localize them and contain them, then we make sure it doesn't become a renewal of the epidemic. In order to do that is that we need to have that data. So when we start talking about returning to normal and all the things that we want to do, that if we don't have that data, it is a crucial gap in order to be able to provide people with the confidence that we can manage COVID-19 going forward over, I'd say, the next 18 months, 2 years.
Thanks, Richard. Just looking at the time, Andy, I don't know if you had any final comments.
Thanks, Ross. Only firstly to thank everybody for tuning in again. We do appreciate people using this to get out the wider messages to people in Greater Manchester. So thank you to all colleagues from the media. Thank you to Sir Richard and to Andrew for really clear presentations. And just to finish from my point of view, obviously it's been a difficult fortnight. And we've had some differences with the government over the last few days, but very much what I would want to stress today is how we want the government to listen to some of the things we've been saying on schools as an example, but also on council funding, another example, transport funding, another, and homelessness. Help us build back better. Help this recovery by putting in place the support, and let's get back to a position where we've got adequate consultation, there's local and regional input into decision making, and therefore we can get these decisions right. I don't want to go to the point that Nigel raised around an inquest or people arguing about things. I think it's very important that we draw a line and identify the things that need to be done nationally and then regionally and locally to get recovery off properly. There is some signs of progress in our figures, but as you've heard on this call today, there's still a lot of caution here in terms of how we think we need to proceed. But progress is being made. Certainly on the green agenda, I think we've got a strong position that's really taking shape, partly because of the leadership of our councils and beginning to make bold changes to our streets and the way our cities and towns work. So we're ready to play our part, but it's very much a constructive offer to the government to listen and work with us and provide the funding that we need to make sure that people are safe on our buses and trams, and that also we can manage the transition of the people who have come into accommodation through the Everyone In policy, that we can capture a lasting benefit in terms of the fight against rough sleeping from the situation we've been through. So, very much that's my message to them today. I hope it's seen in the way it's meant, which is a constructive proposal. And Ross, I think we'll leave it there and thank everybody and thank you and the team for hosting, moderating us again. So thanks everyone for joining, and we'll see you soon.